about understanding the accessibility of healthcare facilities to the older adults. This is the outline of this work. So I will introduce the problem and using the ontology framework to describe the problem. And the third thing is from the, if we know the problem, we will model it. So I will do the application in the ABI model. So ideally, all populations should have the equal access to the healthcare facility. Well, however, in the United States, there still has large disparities in the in aging population when they access to the healthcare facility. So for the older adults, if they have the low income, if they have no insurance, if they are minorities, they maybe have some language barriers, so they will be affected when they getting access to the healthcare facility. For the geographers, we always to concern about the spatial accessibility. So we will consider the uneven distribution of the healthcare facilities if they locate far from my home, so maybe I didn't want to go to see the doctor. And well, another aspect of the access is from the non-spatial, it's from the social factor. So if I don't have money, I have no insurance, maybe also even if I have the disease, I will not to see the doctors as well. So I will from the two aspects to say what's going on in our ontology. So the basic formal ontology I will use in this work. This is some terms I will use in the next slide. So I will skip this one because I think we already know about the relationships between the basic items. So this is the most important in my work is to describe the ontology framework. So you can see the green color. I'm not sure why. Could you see the words in the screen? Yeah, okay. So the green color, like the healthcare provider, is kind of the organizations will be independent continued, and the older adult will be object of independent continued, and the treatment center. The red line is treatment center, the senior center, and the home will be the buildings is independent continued. So why I include the senior centers when in the aging? Why include the senior center? Because in the aging community, they will have some social network at the senior center to meet friends, to taking part, to participate some potential pretensive healthcare screening services. These services will be held by some healthcare programs, such as in the Northern Manhattan, there is a program called the Elder Smile. So Elder Smile program will hold some preventive basic oral health screening tests in the senior centers. So they will have a specific day to hold this event and to let the older adult in that center to participate in this event. And after this screening test, maybe some hypertension, the diabetes, and their oral health, healthy or not healthy, I'm not sure. Because the older adults will to choose to receive their health providers referrals to the following, at a dental clinic to receive the following treatment or not. So from the middle is 8, it's 7, it's 7, no 7, 8, 9 process will be included in this framework. So the blue ones is all the physical process, and the senior ones is health communication and decision making as a mental process. So such as the health communication will have the participants of the older adult and the healthcare provider. They will communicate and exchange some information about the health status, and also the healthcare provider will give them some information to the following treatment. So the decision making will based on some input information about the thinking health behavior. This kind of thinking health behavior is generated from the health communication. And after the decision making, the older adults will be decided which treatment center they will go. So they will have a specific destination and what kind of transportation mode they will choose. So they maybe choose go there by bus, by car, or by some public transportations. And then they will proceed to the motion process. So in the motion process, they will move to the 3 destination: treatment center, senior center, and home. And we can from their travel time to calculate their physical accessibility. So this is the instance example about the 2 days daily routines of one older adult, John. So we can know his age, and the underline shows the process, and the highlight, the bold black word, is the independent continued. So this will be the daily routines of the John. So next thing, I will try to imply this ontology framework into the agent-based modeling. So this is kind of simulation model. So I will simulate the different older adults who maybe behavior differently. So what's the agent-based model? We can to easily understanding. So agent-based maybe the agent-based would be the individual-based. So I will simulate the older adult as agent, and then to capture the agent-based actions and interactions between these agents. And this is an active object class in the ABM. So how can we link this framework into our ontology framework? So, for example, the older adult, senior center, health provider, and the treatment center will be the independent continued. So we will let our independent continued as our agent in ABM model. And then for each agent, for each agent class, we will have some attribute for this agent. So the attributes will be the dependent continued in our BFO framework. And for each agent, they will have some functions. So this kind of functions will be the process, will be some decision-making process and the information exchange process. So this will be the process in the ontology. And the spatial region, we can capture the spatial region in between the agent or in agents to capture their real locations when we do the simulations. And the temporal region, for this model whole process, the temporal region will be the model time unit will be the minutes, and the whole simulation period will be the 1 year. So this is a case study. This case study is focused on the Northern Manhattan, and the level will be focused on the 4 neighborhoods in the Northern Manhattan. So the purpose of this case study is to use the basic formal ontology framework to guide us to building the ABM model, and then the model's purpose is to maximize the access for the older adults who's living in the Northern Manhattan. This is some flow chart in the ABM. So I simulate 100 older adults as mobile agents, which live in a GIS environment, GIS-based environment, geographic information science. So this is some results of this model. So the model will, so I simulate this agent in individual level, but aggregate the information at the neighborhood level. So the right and left is East Harlem and West Harlem is 2 neighborhoods in the Northern Manhattan, and accumulated their travel time and using the histogram to show that. For the conclusions, so this research just uses the ontology framework to help us understanding the spatial and social factors to the adults' accessibility when they go into the healthcare facilities. And also from the problem to the model, we will from the qualitative to the quantitative. So ontology framework will be the intermediate between the two kind of research. Yeah, that's all.
So you can field your own questions.
Is there any question? Yeah.
So I don't know. So Buffalo doesn't really have an idea of like causality, but you had in one of your part you had like proceeds.
Mm-hmm.
You kind of need that in your ontology.
I just talked with Barry, and he suggests me to using the proceed from one process to another.
So it's can you go back to the relevant slide? So where is so what I said, and this would be, I guess, my fault, was precede. So the motion process, so the decision making precedes the motion process, or the motion process comes after the decision making. And that, well, you can continue that. So it doesn't really matter because I think you meant by proceed the opposite of precede. So that's all BFO will allow you to say at the pure process level. The place where BFO would try and say more would be in terms of dispositions. So the communication triggers the disposition to move because the communication has the output, the decision.
So a process causes a process?
So no one knows what causality is.
Okay.
But probably the most orthodox view in philosophy of what causality is that it's a relation between two processes. But you can't say much more than that unless you have something like dispositions which get triggered, which is what BFO supplies. So you need to change that. Anyone? Come on, this is a challenge for the audience now, yes?
To be honest, I mean, the use of the ontology, the usefulness of the ontology here in this application, per se, is not clear to me.
What's that mean?
So in your simulation, so you use the ontology in your simulation, right?
Yes.
So this is like, why do we need an ontology?
This ontology will help us to building the structure of the simulation model. It's not used in the simulation process. It's used in the structure when we're building the model.
So you structure your data according to the ontology constructs.
Yeah.
Did you? I couldn't tell. Did you find any use for like information content entities in your ontology? 'Cause it seems like those would be pretty useful in some of the mitigating parts, particularly for the examinations and what have you. Like Red's report of, from the people who do the exam of the teeth and what have you.
When I'm building this ontology, I just to considering is this about the access, so it's no related to the access. I didn't to add the term.
Okay.
Yeah, I think you are right, but when we're talking about the access, we not consider about that information.
Sure.
So whenever you draw a relationship there, it should follow the pattern for all there is some image. So there are several mistakes there. Can you look at it and point me one out which is wrong?
You mean which part are wrong?
Yeah. So when you say that there is a relation between type X and type B, right?
Mm-hmm.
So it should always be such that it is the case for all that there is some instance of which. So when there are several there where that principle is violated. So I'm just asking if you, now knowing or remembering this, can you find one there where the arrow should either be, well, where the arrow is not correct or should be inverted or there should not be an arrow at all? Well, there are many, so if you pick randomly one...
Well, no, actually, I think many are correct.
I don't think so.
Well, every stay in the treatment center is located in some treatment center.
Yeah, that's
move
all.
to. It's a little odd. Motion moves to home.
But it's not the case that all patients' roles are years in older adults. And the older adult, patient role in years in older adult, that's not right. A decision making as output information artifact is not right.
So let me make a more general point. You have healthcare provider role is realized in, and then you have 4 options.
Yes.
Now, Werner is right that it can't always be realized in all 4 of those. Sometimes it's realized in treatment, sometimes it's
So I
realized in
need to
diagnosis.
separate the lines.
You need to find a way of dealing with that kind of role.
Okay.
And dealing with older adult, you would say patient role adheres in human being, probably your safe thing. And then older adult, subkind of human being. Or the other way around, you could say older adult patient role adheres in older adult. That would solve the problem also. And then another one would be, well, he mentioned motion. So not all motion is moving to the scene. It's the same problem. You have motion dividing, and you can't have that if you're going to have the relations to all some relations. Now, having said all of that, and I think Werner is right, I think we need to think when we're drawing diagrams like this about those relations which hold between types and those relations which hold between instances. If you divide the relations, have relations between types being thick black lines and relations between instances being thin grey lines, then you probably would be able to keep everything that you have. Possible.
Yeah, if it would be an example, if you were talking about a specific adult, for instance, and a specific treatment center, then it might be right.
Yeah.
If you add the time index.
So I couldn't to.
Yeah, you need the time.
So I couldn't to describe the one older adult class has different options at one time.
No, you can't do that. Yeah. So you want to put more in the ontology than you actually can do. So there is a lot of like common sense or facts which might be true within the context of your application that are correct, but which are not correct in general. So you should separate them.
So, Lambda, you had a...
No, my question was related at the same point Werner had concerning information artifact as an output of decision making. I'm not sure that it's correct. So decision making as an output some choice, transportation mode choice, but I'm not sure this is an information artifact.
Yeah, so he's right. Your information artifact means something like a piece of code or a USB particle. And what you're using here could be just a choice in your mind. Choices don't have to do with it.
So if I'm using the choice, what's the type of the choice?
Well, that's the problem. You could have a written down choice, or you could have a choice made in your head. If it's made in your head, then it's a quality process, the choosing, which issues in quality, which is your core disposition.